September is Ovarian Cancer Awareness Month, and most of us don't realize that ovarian cancer is the most fatal women's cancer. Research has shown that awareness of symptoms and early diagnosis can lead to better outcomes, and that begins with conversations like this one. Joining us now is Dr. Jeanette Boudreau, Associate Professor and Ovarian Cancer Canada funded researcher, and Charlene Wallace, Ovarian Cancer Canada Community Engagement Lead. Welcome to you both. Thank you so much for coming in.
Thanks for having us.
Let's begin with you, Charlene. Who is at risk of developing ovarian cancer?
Well, really, any person with ovaries is at risk of the disease to a certain degree. Genetically, if you have the mutation or family history, then you're at a much higher risk of getting the disease.
So what are the signs and symptoms, Dr. Boudreau, of ovarian cancer?
Yeah, so a lot of these symptoms and signs, they come early and they come in a very non-specific way. So there are things like bloating that you can't explain that's persistent, not feeling hungry but at the same time feeling full really quickly, changes to urinary habits, and things like abdominal pain. But you know, as a woman, you're sort of changing, and these types of things can be easily explained away, and so they often are. It's the persistence of these symptoms that sort of encourages women to talk to their doctors, and should be encouraging doctors to start some of the imaging and the screening tests that can help to detect the disease.
Well, this is the shocker to me, Charlene, is that the Pap test doesn't pick up ovarian cancer. Is that true?
That is very true, and it's a huge misconception. Many people think, well, I'm going to my regular tests every year, I'm getting my physicals, I'm looking after myself, and so it should be detected. It's absolutely not. Pap tests do not detect ovarian cancer.
Well, I'm so glad you came in, because it's really important to have this conversation. So detection it's difficult to recognize the symptoms because we shrug them off as anything, you know, and Pap test doesn't pick it up. So when do you have these conversations with your doctor? Because I imagine a lot of people might be experiencing ovarian cancer risks, or maybe even have the issue, and they don't know.
Mm-hmm. Yeah, absolutely, and it's such a vague thing to say, but it's important that you know your own body, right, and that you can advocate for yourself. So as you're going into those, you know, physicals and you're getting those tests done, and Pap tests are important, they're just not detecting ovarian cancer.
Yes, exactly.
But think about that as a sort of a check-in, right? So how are you feeling? Have things changed? Are there changes that, you know, sort of you can't explain? And have that conversation with your doctor. Ovarian Cancer Canada has a great tool on their website that helps kind of for you to assess your risk, but also to advocate for yourself and to talk to your doctor, and the sort of points you need to be looking for and raising with your caregivers.
That's a great resource. So Charlie, do you want to add exactly how you support women in detecting and understanding ovarian cancer, and then supporting them if they do get diagnosed?
Yes, absolutely. We have a great advocacy and a program through our organization. Women can connect, those especially who have been diagnosed with ovarian cancer, and their families can connect with our program, people who will, you know, just support them through every step of their journey. Knowing how to access the care, what kind of questions to ask your caregivers and medical professionals, and really being the organization that's standing behind them, supporting them in every step of their way.
Fantastic, and we put a link to those very practical and important resources on our website to make it easy for you to find. Dr. Boudreau, we've got about 30 seconds left. Last word. Tell us about, you know, leave on a positive note, kind of what's next and where advancements are going in research for ovarian cancer.
Yeah, thanks for the opportunity. So Charlene mentioned there's some genetics that run in families, so family histories. We're learning to understand how to look for those genes, how to counsel people on their elevated risk for cancer. So I'm excited about that. And identify what we call previvors. These are people at elevated risk, and get into imaging and screening a lot earlier for them, screening sort of meaning by imaging and looking for these things. There's also opportunities in terms of how we're going to help patients that are already diagnosed with the disease. And what I'm really excited about are called immunotherapies, or these new strategies that use the immune system itself and sort of give it a boost to help recognize the cancer, and collaborate with, you know, the chemotherapy and the surgery that patients are going to undergo to hopefully rid them of the disease so it doesn't come back.
Well, thank you both so much for coming in and having this important conversation.
Yes, thank you for having us.
And a reminder that we do have the link to the Ovarian Cancer Canada website on ours to make it easy for you to find. But yeah, put it on your radar. This is an important conversation that you could be having with your doctor that might save your life. It is now 7:26. We'll be back with more Your Morning Atlantic right after this.